So once I'm able to visualize a cervix with the speculum, I take what's called a cyto brush, which looks like a little broom, and I insert it into the vagina right at the cervix, and then I sweep across the cervix to pick up some cells. And then I put those cells in a cup like this, and then we send it off to the lab for our pathologist to take a look at. Hi everyone, my name is Amani. I'm a board certified physician assistant here at Dardur Gynecology, and I'm here today to talk to you about pap smears. So what is a pap smear? A pap smear is a screening test used to detect atypical or precancerous cells or cancerous cells on the cervix. How does it work? I or another gynecology specialist will take a look inside the vagina with something called a speculum, which I have one to show you here today. So this is what a speculum looks like. And we at this office have these in many different sizes, some smaller, some larger, to help accommodate different patients and make this process as easy and as comfortable as it can be for you. So I would insert this into the vagina, open it just a little bit until I visualize the cervix, and I have a little diagram for you as well. So this is what the female anatomy looks like. This is the uterus. This uterus has some fibroids in it. If you don't have fibroids, then these will not be present in the uterus. Here are the fallopian tubes, the ovaries, the vagina, and then the star of the show, the cervix. So once I'm able to visualize a cervix with the speculum, I take what's called a cyto brush, which looks like a little broom, and I insert it into the vagina right at the cervix, and then I sweep across the cervix to pick up some cells. And then I put those cells in a cup like this, and then we send it off to the lab for our pathologist to take a look at. So why is getting a pap smear important? It's important because it helps to detect atypical or precancerous cells. So cells that haven't turned into cervical cancer yet, it still shows those on pathology, so then we can help prevent cervical cancer from happening in the first place. It also detects cervical cancer, of course, which helps us to treat patients, to create the best possible outcomes for them, to get them back to living their happy and healthy lives. It also detects HPV. HPV is short for human papillomavirus, and it is responsible for things like genital warts and, more importantly, cervical cancer. There are two main types that we worry about the most, 16 and 18, because those have been shown to be linked to cervical cancer. So if we have a patient who comes in for their pap smear and the cells on the cervix, they look fine, they haven't been changed at all, but the pap smear detects HPV type 16 or 18, now we want to have our eyes more closely on the patient to make sure that those cells aren't changing over time due to that human papillomavirus being there. So we would do pap smears much more often on that type of patient versus another patient. So we would do pap smears maybe yearly on that patient versus everybody else who has normal pap smears, negative HPV, we would check them every 3 to 5 years. So pap smears start at age 21. So it's so important if you are 21 and older to get your pap smears to detect for atypical cells, precancerous cells, cervical cancer, and then that so annoying HPV that causes cervical cancer. It's so important to get your pap smears. So if you haven't already, please give us a call to schedule an appointment with us at 708-340-1167, and we will see you for your pap smears. Bye.